Are there any kind of ultimately some long-term risks from a transplant?
Yeah, so we've talked about the risk of recurrence both after surgical resection and after liver transplantation. But these are, outside of that, these are invasive procedures. So they are surgeries and can have a risk of post surgical complications, bleeding, infection, etc. But then also, after a liver transplant, you do go on immunosuppressive regimens. So you do go on typically tacrolimus or sirolimus after the transplant to help reduce the risk of rejection. The degree of immunosuppression required after liver transplant is much lower than other organ transplants, but there is still potential risks of going on those therapies longer term. For example, you can have a kidney injury that happens over a longer period of time. Of course, there is still a risk of rejection. So these patients will continue to be monitored closely by their doctors to make sure that they do well after a transplant. And even though these risks exist, it's important to reinforce that most patients do very well after a transplant. And the goal here is to give good quality of life and to return a patient to a high level of functioning, which is the expected course in patients undergoing surgical resection or liver transplantation. So I think in general, I think the summary that I'd have is that these are curative procedures. They can give good long-term survival. They can give a low risk of recurrence. And these should be considered and discussed with the care team if and when possible.